Hi, everyone. Welcome, welcome. Please let me know if you can hear me. I have a microphone, so this is new for me. I'm not really a public speaker. So in the chat, please put where you're from. Hi, Billy. Hi, Joseph. Hi, Wayne. Hi, everyone. Hi, Judy. Where are you guys watching from? We're going to give people a couple minutes, probably about 5 minutes to come in. If you haven't gotten any pen or paper, let me know. Okay, good. You hear me. Okay, good. I think this would really help because then I don't have to yell and then by the end have no voice. I found maybe an investment would be good for you guys. Oh my gosh, look at all these people. I'm so excited. You're in the right place, guys. You all have one thing in common. You've wasted probably thousands of dollars. You've been dismissed by many doctors, and you all have some type of nerve issues. Hi, Terry from Washington. Hi, Anne from Colorado Springs. Susan from Florida. Sue from San Diego. Hi, everyone. We're going to keep this a positive chat. Okay. And guess what? At the end, I will go over a nice Q&A portion of things. You guys will have questions, guaranteed. So please, if you already have questions for me, put them in the Q&A section specifically. And if you see, it says my name right there, Adrienne Guthrie. I'm Dr. Adrienne Guthrie. That is actually Kevin, my patient coordinator. Everyone say hi, Kevin. He's working back end for us. Let me get my everything going, my slides and everything. We have a couple hundred people that are going to be here today. If you have any questions to start, please put them in the chat. I'm going to share my slides here in a couple minutes. If you haven't gotten a pen and paper, I highly suggest getting a pen and paper. There's going to be a lot of information that you have not heard before. If this is your second or third time coming in for to listen to me do a webinar, they're different all the time. So welcome, welcome. Yeah, Kevin's great. He's my wingman. You guys will definitely get to know him if we do end up working together. But my main goal today or this evening, it depends on which time zone you're in, is to educate you guys. I'm an educator, okay? I want to bring awareness to what is really going on with your body, what I typically find. And I'm sure most of you guys don't even know who I am, so we will start with that, obviously. I'm a doctor of natural medicine. Let me get my slides ready. We're going to give it about 2 more minutes. Where are you guys from? Rita, Jan, Denise. I like how you spell your name, Denise. It's very pretty. Hi, Susan. Hi, James. I have a photographic memory, and some of your names are looking familiar. I might even have some patients I'm working with. Welcome all. They like to join in sometimes. And if so, let them know your experience so far. That's always good. Luann, Charlie, hi. Everyone's saying hi to Kevin. I love that. Put that in the chat. Gudrun. I have a PhD. We're going to, let's see, one more minute. Okay, everyone? 1 more minute. Get some water. I do recommend it. We're going to be here for a little bit, at least an hour. Okay. There's typically a lot of questions at the end, and I will go over, I'm going to try and touch all of them. So that's my goal. Typically I get a little bit tired, talking. I'm not a big talker, but this is our time. So this is going to be a big one, and I hope you guys hear me good. Hopefully it's not too loud. All right. So I'm going to get started. It's 4:05. Let me share my slides. So obviously, if you're here, you kind of have an idea. You guys all have nerve issues, but yes, how adults with neuropathy are reducing burning, tingling, and numbness within 3 months, but naturally. That's the biggest thing. Root cause strategy. That's what I'm going to go over. We're going to do this without medications, without being pushed medications or surgery, which I'm sure a lot of you guys have already had that issue, right? And without being told it's idiopathic, permanent, or something you just have to live with. There's going to be a lot of information. This is me. I'm Dr. Adrienne Guthrie. I'm an award-winning functional medicine practitioner. I'm a doctor of natural medicine. I specialize with neuropathy and complex nerve specialists, but also I like to say chronic health issues that no one could find what the heck is going on. A lot of people are referred to me with those cases. So important fact, most neuropathy is labeled idiopathic. This is a very active chat usually. And I want to encourage you guys to talk in the chat, communicate. You guys all have that in common, nerve issues, right? But I want to know who has been told that their neuropathy is idiopathic, that has no cause. That's what that means. For lack of better words, it's kind of a bunch of BS, and I'm going to tell you why. Okay. But it just means really that the right things were never tested or connected correctly. And that's basically what we're going to go over. Yeah, Jennifer, yes. And also we're going to go over some of the things that do come back from my tests. I think the problem is there's thousands of beautiful tests out there, but if you don't know what to test for or look for when it comes to the nerves and you're not a nerve expert, you're going to either have people constantly testing or you're going to not know what to look for, right? So I'm going to kind of go into that. We're going to basically go over what is commonly missed. And I do have a guarantee. So that'll hold you guys here too. Not only are we going to go over information, but when is that ever in healthcare? Or I like to say healthcare, right? Anyway, we'll go into that too, but put your questions in the Q&A. I encourage them. We're going to try and go through every single one this evening together. So today I'm going to show you a clear path to improving neuropathy symptoms by identifying and addressing the true root causes. Everything starts at the cellular level, either an embryo being made or something not so beautiful such as cancer, right? And so that's where you find your root causes, what's going on there. So what you truly need is a cellular level test, not a stool test, not a urine test, not a blood test, a cellular level test. So we're going to talk about what that looks like. And for all those that are here, which is, I'm sure all of you are going to say, yes, me, I would love to see. But for all of those that are here right now, I guarantee you all feel you have tried everything. Have I hit the nail on the head right there? I feel like, yeah. Because most people, when they're referred to me, that's what they say. But you haven't, okay? We're going to be going over, we're going to identify and address the true root causes together. What comes back on these labs, right? Even if you've been told your labs are normal, and I'm going to tell you why that happens, and even if you've been dismissed by doctors, which I can dang well guarantee you all have. I did. I was dismissed by doctors. I had nerve issues. Growing up, I had to relearn to walk and write, and that's kind of what put me in this position. God had me live it a little bit. And I do mention a lot about God. I am very faith-based, rooted, functional medicine. We are rooted in Christ here. So I hope it doesn't bother anyone. If so, you can kindly leave. But even if everything you've tried hasn't worked, we're going to go over some of these things, okay? I'm sorry, Mary. She says 5 years, tried everything. My typical patient, they've had neuropathy or nerve-related issues. So maybe they haven't had it actually diagnosed, which you don't necessarily need. That's really just to get a prescription, right? So if you're having any nerve-related issues, and you've tried everything that works, my typical patient, they have had these issues for anywhere between 5 years to 30 years. I deal with the hard issues, right? The hard, complex cases. So before we begin, there's 3 important agreements. Agreement number 1, which I feel like is probably the most important. What I'm sharing today is going to challenge the idea that neuropathy is random or permanent. It requires your full focus and openness to think differently. We have all kind of been brainwashed. Maybe not all of you guys, if you're here. I mean, you kind of know this is a little bit more natural medicine, right? But the majority of people feel that, or only know that, or I don't know how to explain it, that conventional medicine is the only way. Conventional medicine is beautiful when it comes to emergency care. But when, like, if you get in a car wreck, don't call me. I can't help you. But when it comes to actual healing, getting to the root cause, no chemical cover-ups, keeping you constantly sick, right? What I do is actually going to trump conventional medicine any day of the week. So you're definitely in the right place finally. Yay, right? Agreement number 2, root cause healing is not passive. It requires the right test, the right interpretation from an expert, and structured action, not just detoxes. Those don't work, especially when you have nerve issues. It causes more problems. I'm sure you've done them. And if you're looking for a miracle pill, this training is not for you. Go ahead and exit out. There is no pill or cream that will universally heal all of you. That's the problem. Everyone's looking for the cure in a pill form or cream form. It doesn't exist, because every case I've taken on, I've worked over 400 cases just this year. Let me add that in. And let me tell you, every case that has been put before me, every time, it's always different, which is kind of exciting on my part, because if it's the same every day, it'd be a little bit difficult, right? We all have our own root causes. I had my own root causes as to why I woke up and had no feeling from head to toe. My worst nightmare, anyone's worst nightmare, I was getting ready to graduate high school, had 2 months left. I had to relearn to type and walk. It's very scary. I'm fine now, obviously. But, autoimmune disease for me was one of the issues. My body was kind of shutting down and my nerves were letting me know. And I'll go into that more. And some of you guys have an autoimmune disease, or you have a question of that. And I'm not saying that that is what's causing neuropathy, by the way. We all have root causes. There's always more than one issue. Agreement number 3, at the end, I will share 2 ways you can work with me directly, but only if it's the right fit for your goals and your readiness level. But honestly, the takeaway that you're going to get from this is knowledge. It's going to change your life. I guarantee it. I hear so much good feedback from this webinar when I do them. Important. This works best when you take notes. Write down questions as they come up, and we will address them at the end, okay? Please put them in the Q&A. That helps me so I don't have to sift through thousands of yeses or comments, okay? This is your time to finally understand what the heck is going on with your body and feel confident finally in possibly someone that you can work with that knows what the heck they're doing, okay? And to ask questions. So if you're still here, that tells me something important. You're not looking for another Band-Aid, because I already told you to leave, right? I'm not going to sell you some pills at the end. I don't actually sell anything, okay? You want answers, and you deserve them. So I do have a couple client breakthroughs, of course, for people that I have worked with. These are all from Google. Okay, I just started actually building the Google presence, but I think like last year. But anyway, you can find these all from there. So after 5 years of neuropathy and treatments that left me feeling worse, I decided to try functional medicine with Dr. Guthrie. Just 5 weeks into my healing journey, I feel 100% better overall, and my neuropathy pain and numbness have improved by about 75%. Now, I want you guys to know, as I go through this, I will never say I'm going to cure your neuropathy. I'm going to fully heal you. For one, I don't believe that I'm the healer here. I am the vessel. But what I do guarantee is that I will get to the root causes as to why you're having the issues. And then it becomes a no-brainer as to what to do about it. Okay? We have a very high success rate with people that work with me. And we'll kind of go into that also. If you want to reduce burning, tingling, and numbness without being told there's nothing more we can do, I'm sure you guys have heard that, I want you to stay with me. I know it's hard to trust people. I've been there. This is what you're going to learn, okay? You're going to walk away happy, I promise, with knowledge of what the heck you can do. So here's what you don't need: another prescription that only masks symptoms. Can I get an amen? My gosh. All these MDs are just pushing these like candy. They get commission from the prescriptions, from the immunizations, right? I have multiple AI. Okay, I'm going to try not to read your questions. More random supplements without testing. To accept idiopathic as your final answer. To believe nerve damage is always irreversible. To live in fear of progression. To feel dismissed or unheard. And that's one that I really lived with for the first 30 years of my life, right? I guarantee if you're here, you are done with the BS of medical doctors. You have been through the ringer. You wait months to get in. You sit there for possibly a maximum of 20 minutes to then be, pushed either surgery or medications, right? I've been there. Okay. I've gotten spinal taps. Oh man. Well, one, sorry, spinal tap, I guess we'll say. I didn't have more than one. Anyway, a lot of things. And I can relate with some of you, not all of you, right? I'm not saying that what I went through was anything compared to what most patients, the stories I hear. I will tell you, and I got your message just now, the cellular level test, we will definitely go over. That is the main thing about all this, what you're going to learn. It's different. To believe nerve damage is always irreversible. That's a dismissal. To live in fear of progression, to feel dismissed or unheard. I'm sorry, I said all that. Or to become a medical expert yourself, right? ChatGPT. It's great in a way to help you guys to try and self-diagnose because you're being dismissed so much, right? Same with Google. I remember looking on Google and I found out, because no one could find out for like 28 years, that I had celiac disease. And thank you, Google. Right? So no hate there, but are you tired? Yeah, you're tired and you need help. So we don't need you to be doing that anymore. Before we go further, let me share why you can trust this. Here I am, all dolled up, award-winning functional medicine practitioner. I was recognized last year as the best emerging leader in functional and natural medicine in the United States. Very exciting. I specialize specifically in neuropathy and complex nerve disorders. I finally have MDs, thankfully, referring their patients to me all over the US. So it's very exciting because thank you. Not because of money related. No. Because please stop giving these people these pills. Like, are you kidding me? That is the best thing you can be doing, right? So it's very exciting how this is working, and how many people I've been able to help. It's getting out there. So I'm very happy about that. My practice has been built solely through referrals from past patients. So I love that. A lot of people I've worked with, they refer their friends, their family, they love me. I actually become like their, primary functional medicine doctor instead of their primary care physician, which obviously you need the two. I'm not saying that 100% is I'm going to be able to help with everything, obviously, right? But a lot of stuff, I can tell you. I've been featured in news outlets, including Newsbreak and USA News. So the old way that keeps you stuck, hopefully you guys hear me. Maybe I should do that. Your labs are normal. It's idiopathic. Just manage symptoms, take this medication, and we're done. We're done here. We're done with this. That approach leads to ongoing fear, uncertainty, no clear plan, just constant cycle, right? What most people try that doesn't work, and I would love for you to put in the chat which one of these is you. If it's all, I've gotten that before, right? But the main ones: gabapentin, Lyrica, antidepressants. Mainly gabapentin, Lyrica. Are you having to take these in order to function. There's no hate here, right? This is a very positive chat. We're going to keep it. Is that what you were forced to take? Pain medications that suppress but don't correct. I'm actually going to go into why that's so dangerous too. You guys seem very quiet now. There we go. There we go. Hi, Julia. Yes, gabapentin. Yeah, tried all. Nothing changed. Yes. B12 shots. I mean, this can be great if you're deficient in B12, but if you're not, could it hurt? Yes, it can, right? But for all of the people that are here right now, if you have tried random things, obviously you're doing everything you can. You're grasping for straws here, right? Generic diet changes, random nerve stacks, I call it. I'm sure you have bought all the supplements and they don't work, right? Because they're not the right way for your body. We need to know exactly what's going on and then kind of attack mode on those things, right? When those fail, though, you're told it's permanent, right? Yeah. My goal, obviously, if you are taking gabapentin, Lyrica, is to obviously when we get to the root causes and we find out everything that's going on and we work on the issues where you no longer need those and you have that conversation, let me specify, with your primary or whoever prescribed them. My goal would obviously be at that point so you can get off of these medications. God put on the planet things that our body needs in certain times to help us. Oh, we're just getting started. That's great. Denise, you're probably one of the few people in here that are not on anything. And that will actually really help with your healing because it's not so much of like an uphill battle, right? But most people that I work with, that's not the case. So don't worry if you are on things, right? So the new way, and this is me kind of touching base on what we're going to go into, but it's called the root cause neuropathy framework. I know I named it. It's kind of silly, but step 1, advanced testing. I'm sure you've all had tests. I'm sure you've all felt like you've tested all the tests, right? But this is different. We're going to kind of go into it. So the cellular level test that I'm well known for is a specific hair follicle test. Now, if you look up right now on Google, hair follicle testing, those are HTMA tests. Those are hair mineral tests. Okay? Those are different. Those are completely different. Those are good for mineral analysis. This is way past that. We will see even, okay, I'm going to give you a couple of examples. We'll be able to determine if you have a parasite in your lower intestine, what type it is, how long it's been there. From your hair follicle. Hair holds memory. It's going to tell us everything about you. We'll be able to determine all 60 of the nutrient deficiencies that should be tested. Some of them actually, if you're deficient, will kill your nerves, and they're not even tested for in conventional medicine. Exciting, right? We're not talking B6 or B12, guys. We're talking a lot more. Chromium, iodine, potassium, all of them. That's just a little taste tester of what this test is going to do. Over 600 plus biomarkers, I want to say 620, will be tested just on this test alone. The other test I send to you in the mail is a finger prick test, not a fingerprint. Don't ever give your fingerprint away. A finger prick test. So we just prick the side of your finger. I get 3 drops of blood. And that right there is all the blood that I need because I specialize with blood in the cells. And that's going to tell us all the guessing work from foods. We're going to take that out. No more guessing. No more, maybe I'll try this diet. Maybe I'll do that. And trust me when I say I am not about removing a bunch of food either. And this is part of the Q&A, what I'm going to go over. If these questions don't come up, which I guarantee they will, I will I have a set of normal questions too that I'm going to go over just to make sure you understand fully. This isn't an elimination diet process fully, right? There might be a couple things if it's bad, but that's just a minimal reason why. But also a candida screening we will do with that. And I want to say 7 out of 10 people that come to me with advanced neuropathy or nerve issues, they have a candida overgrowth that has gone unnoticed. And that is one sometimes of the root causes, but never is there one. And we'll go into why. So that would all be step 1. You know, I send those directly to you in the mail. You don't have to go anywhere. Okay. Remember, if you guys have questions, put them in the Q&A, please. They are very welcome there. I will be going through them all. Step 2, root cause identification. Interpret patterns often missed on standard labs. This is basically, in a nutshell, where I break everything down for you. I'm not going to email them to you directly until we actually break them all down. I want to make sure that you understand what it means. And, you know, conventional medicine, you're sent your labs and you're like, okay, what does this mean though? Right? You're going to fully understand. And it can be overwhelming because I think the amount of things that come back, you're used to. All of you guys are used to being told that your labs are normal, or okay, you might have 1 or 2 things weird. And I want to tell you why that is. So conventional medicine, healthcare, we'll say, their lab ranges are completely different from functional medicine. They take a national average of an already diseased person, and those are the ranges they go off of. So if you're not coming back in those ranges, congratulations, you're actually healthy, but your nerves are doing what God intended to do for them to do, and that is alerting you to something that's wrong. Okay, this is my cue to tell my favorite little blurb about what your nerves are really doing. And it's going to blow your mind because a lot of people, you guys are living it. You're in pain. At night, sometimes it's worse. Maybe not for you. Maybe it's worse during the day, whatever, right? Every case is different. But I want to tell you that this is something that your nervous system, your nerves are supposed to do when there's a problem, or 2 or 3 or 4, right? Or 30. A lot of problems usually. So when you go and get a root canal done, they remove the root of that tooth, correct? And then they put a cap over that tooth. Now, please tell me, what would happen if you got a crack in the tooth and you got an infection there? How would your body alert you that you have an infection in that tooth so close to your brain? I'll wait. It cannot. That's exactly your nerves are trying to tell you if something is wrong, and you know it in your gut. That's kind of why you're here, right? You know something's wrong, and everyone just keeps on dismissing you, and everyone just keeps on, telling you, oh, no, you're fine. And you're like, I'm not fine. I feel like I'm going to lose my feet or whatever the case, right? You're not. You're not. There's something going on. You're right. I'm here. I'm here. And you're finally hearing it from someone, right? You are in the right place. So I like to talk about that because a lot of people don't think about their nerves that way. They really don't. We don't think about how dangerous it is that we have to take the gabapentin, but it's numbing that alert mechanism while things progressively get worse. Yeah, poor Deborah right here. She said gabapentin, over 20 years. Poor thing, right? And it's just masking it so she can just function probably, if even that. And I'm sure most of you here that you've been given it to because you've been told, well, here, take this. You don't know what you're doing. You don't know anything but what you know. Okay. So I'm so thankful you're here. And I really believe it's God led. I really do. I pray before every single one of these that everyone that comes before me it's aligned. Step 3. And I really went on that step 2. So sorry. I'm bleeping out. Someone said I'm bleeping out. Well, can you guys hear me? Please confirm. So it could be this new. Can you guys hear me? I want to make sure. I'm using a new mic. Yes. Okay, good. If you guys notice, please, now I have trust issues with this thing. It's the first time. Okay. So if I'm going like in and out or you can't hear me all of a sudden, please say, hey, you're gone. Stop talking to yourself. Okay, good. Okay, a lot of yeses. Okay. And I think I have your guys' attention, right? Does this kind of make sense to you guys so far? Okay. Thank you, everyone. Does this make sense though? I've heard before people that have been, I get it. It's coming from a place of pain. They've been hurt. They've been dismissed. They've been failed, we're going to say, by the system. Will come in here sometimes and they just expect that I'm a snake oil salesman. I've been called it. But how is this snake oil right here? This is what our body is meant to do. And I'm trying to educate you guys to see things differently than what you've been told for the first time ever, right? Okay, good. Uh-oh, Anne's having a hard time. Okay. I don't know, Kevin, can you possibly help Anne Herbert? Okay, and I don't know if he can or not because he's all back end. I'm not sure if that's even possible. So I'm sorry, and okay. So step 3, structured treatment sequencing. We're not just going to go in and do, say like, whatever comes back, and we'll go into some of the things that come back. I even mentioned like parasite, right? That'll be tested, mold issues, all of it, everything. Okay. So say like we find these things, we're not just going to go in for a full on detox because let me tell you something, that those don't work. And okay, these elimination diets that are being expected of everyone, those don't work either, right? It might help to eliminate specific foods. And yes, we would do something like that temporarily. This is not supposed to be 6 months plus of you miserable eating lettuce for that amount of time. And that's it. How are you supposed to succeed, right? This is precision, not guesswork anymore. Oh, good, Anne. Welcome back. So why this approach works when others don't? Well, I look beyond normal lab ranges. Functional medicine is amazing. We base our labs off of the optimal health of the person. So that's a beautiful thing. We could find things before things become something that shows up on the already diseased labs, right? We don't want you to ever show up in those ranges. And so if your body's alerting you, there's something wrong. And the best place to start, if you don't work with me, you need to start with a functional medicine doctor. The problem is a lot of people charge an arm and a leg. And I think you're going to know that also, or you might already know that even. I identified toxic burden, deficiencies, inflammation, metabolic dysfunction, things that don't show up on standard labs. The things that we're testing for do not show up on urine analysis, stool tests. You would have to individually test for all these things and then combine it all together. It's very hard, right? There's not one test. This is kind of the test, though. I'm going to go into it. I say that, but then I kind of backtrack on that. But we're going to connect the patterns instead of isolating symptoms. That's huge. And this was built specifically for neuropathy, not generalized protocols. This is not a cookie cutter approach. I don't take one protocol that worked for Jane Doe, we're going to say, and then give it to Bob Smith or something. Look at the names I'm coming up with, guys. It's funny. It's always different. It's always custom. It has to be customized to your body because as we know, and I've already taught you in the first, 30 minutes, the reason why one pill and one cream in the world isn't going to heal everyone from this is because you all have different reasons. Okay. So you obviously need different healing, different paths to healing. So it's going to be personalized to your body, not standardized templates, focuses on restoring function, not masking the discomfort anymore. You've been doing that. Client breakthrough. I suffered from severe neuropathy in both feet for over 6 years and tried everything from medications to acupuncture without relief. After starting Dr. Guthrie's program, I began noticing a difference in just 2 weeks. Her support and responsiveness have been incredible, and I'm committed to following the program fully. So most people think I just need better medication, but the truth is, and I think you're getting it, you need clarity on what is damaging or stressing your nerves. Okay. When the drivers are addressed, the symptoms often improve, and it has to make sense. It has to make sense to you that you just haven't found out what the heck is going on. And this won't be an overnight thing. No, it will not. But this will be a measurable experience, and it will happen in phases. And I'll go into that. So what you won't have to do, what we're done with. You do not need to keep cycling through medications. We're done here, right? Now, please don't stop taking your medication without having that talk. I have to say that, right? We're done guessing. We're done guessing which supplement might work. Here, $60 here, $30 there, $20 here. Oh my gosh, you guys, it's funny, but it's not funny, right? But I want to say, like, every case I've worked, you guys got a lot of supplements. Yeah, you've got them all, or you've tried everything, right? And everyone on social media has such an opinion. You need to do this. You need to try that. Half of them are scams, and maybe something worked for someone else. And so you tried that. We just need to get all these opinions out of the way and find out exactly what's going on with you. Really. You need to stop wondering if you're too far gone. Accept that nothing can improve. So we need to get you there. This isn't about becoming someone different. We don't need perfection here. Not here at Root of Functional Medicine. Absolutely not. Every protocol I actually write up, and you'll hear me say this if you work with me, 80-20. 80% of the time, if you try your hardest, you're going to have success. No one's perfect. I don't expect perfection. There's that 20% buffer. There's people that have specifically told me, and I'm not encouraging this, but I will not stop drinking my wine every night or whatever, right? Everyone has their little bit of a vice. Me is coffee. If someone told me to stop drinking coffee, I would laugh at them and say, my kids need me. Okay, it ain't gonna happen, right? So we need to have that 20% buffer. Come on, this is real life. No one's perfect. I am not going to follow something to the T. There's no way, and I don't expect anyone to do the same. And I think that's what people really love, and that they actually have the success from that. I think taking the perfection and the need for perfection out of things helps people relax and feel like, okay, I might be able to actually do this, right? So this isn't about becoming someone different. It's about just seeing the full picture, what's going on, what to do about it. So client breakthrough, my 9-year-old daughter had severe gut issues and constant meltdowns. We were told it was just anxiety. Dr. Guthrie helped us uncover hidden food sensitivities and mineral deficiencies. And now my daughter's thriving. Total game changer. So what makes this different from other programs? It's not a generic nerve support formula, not symptom management, not one size fits all protocol, not a DIY internet advice. This is personalized lab-based strategy, direct interpretation, structured sequencing. So those are those phases, and I'll go into that. Ongoing clinical guidance. Who this is not for? Those who want that miracle cure. I'm not going to do that. It doesn't exist. It's going to be a little bit of a process. It typically takes about 3 to 6 months. Okay. For every case I've taken on, I don't think it's taken more than 6 months. Those unwilling to test or investigate deeper. Anyone who only wants symptom suppression, keep doing what you're doing. Individuals unwilling to participate in their own healing. People closed to root cause explanations. I feel like if you're still here, then you agree with these things, right? You're in line with it. I understand what you need most right now. You don't need just less pain. Obviously, we need the less pain, but you need certainty. You need to know, is this progressing? Is there permanent damage? Am I missing something? And you are. Like I said, you are missing something. And I know that I just saw someone's trying to hurry for me to get to the point, and I'm making the points. And I'm not going to rush through this for you. I want you guys to hear this. I want it to resonate. A lot of you are leaving work right now, or you're heading home, or whatever the case. Get comfortable, okay? We got a Q&A that's going to be big at the end too. And I know some of your questions are going to be there. We're not rushing this. I'm not rushing you. Okay. I'm not done with you guys yet. Is what I'm saying. You need this attention. You need this. You need clarity. So I'm not going to address that comment I just saw. But how I intend to make this the most valuable hour of your health journey so far: explain why neuropathy is rarely random, show you what standard labs miss, break down the most common hidden drivers, explain why past treatments have failed, show you the step-by-step correction sequence, and if appropriate, share how to work with me directly. But regardless, you're walking away with all this. The knowledge, what to do, what might be going on, right? So meet Dr. Adrienne Guthrie. This is me. This is the last time I'll say this, because we actually have people going in and out throughout the hour. But I'm an award-winning functional medicine practitioner. For those of you that didn't hear, I am a board-certified doctor of natural medicine. I specialize specifically in neuropathy and complex nerve disorders. I will go more into my credentials and everything, but I trained under a physician who dedicated over 30 years exclusively to neuropathy care. And I'm known for identifying patterns others overlook. I built a referral-based practice through real patient outcomes. Why you can trust this approach: I have advanced training in functional medicine, parasitology, and longevity, which is always fun. A lot of people love that aspect of healing, right? Anti-aging, that's natural, things like that. So it's, once the heels are good, or the nerves are good. The heels, I'm so sorry. Once the nerves are all good, or at least we are 70% or better, is typically what I hear, permanently, then a lot of people, they want like that aspect of things, right? Thousands of a lot of clinical hours, clinical training hours, including nursing school even. I was featured in national media outlets, recognized nationally for excellence in natural medicine, and I focus exclusively on providing clarity, precision, root cause correction. And I also love that I have a practice where every single one of the people I work with feel like they're the only person I work with. That's my goal. You're not going to be brushed off. You're not going to be sent to another practitioner that works under me. I'm very selective of who I work with. I've helped a lot of people, but I also will only take on a certain amount of people, right? I don't want to be overwhelmed where I don't have the ability to. I have 2 children. One's 3. One is a hurricane boy that's 11. He's like 6 kids in one, right? So I need that time to myself. If I took on too many, it would just be too much. So I pride myself on that. I built the type of healthcare that I always needed and wanted for you guys, okay? My professional journey: I worked alongside a physician who dedicated over 30 years exclusively to neuropathy care. He was an MD. His name was Dr. Manny. He's no longer working as an MD, but he was great. He specialized in neuropathy. I didn't pick to actually go into neuropathy. God literally lined everything up. And now that I look back, I have the awareness to say, the first 30 years of my life, as I mentioned, were literal hell for me. I was sick all the time. I didn't know why. I was miserable. I had the nerve issues that came, and then went away eventually. But yeah, so God had a plan. I kind of had to live a little bit of it, I think. And so then he put me alongside this doctor, and I agreed with some of his things. I didn't agree with a lot of the things. So at the same time of this, I was completing advanced education in functional medicine and clinical science, raising it, I think, a baby at the time, right? And yeah, so I saw what worked and what was being missed, which I think is bigger, right? In a way. That's when I knew that this would become my focus. I had to give into it. The day everything became clear, I watched patients repeatedly told there's nothing more we can do, right? I'm just going to say right now, I know that most of you guys have heard that, or basically it's idiopathic, right? It's a crock. It's dismissal. This is all dismissal. You're not broken. You're not imagining symptoms. You're just not being tested properly. And that's just, not very many people out there specialize with the nerves and are an expert in neuropathy or nerve issues. So they don't know. And you're kind of like the guinea pig in a way, right? I'm sure you felt that. There is a better way. And I knew it. My personal turning point, I realized the biggest issue wasn't that neuropathy had no cause. Because I'm going to tell you, and you're going to learn today, let me tell you, that there's multiple causes. It was that no one was connecting the dots. Patients are being tested in fragments, one system at a time, or constantly in a state of testing, right? I have to drink out of a water bottle. Give me 1 second. I forgot my cup. But neuropathy is rarely a single system issue. It's a pattern. There's actually not been one case I have worked on in over 400 cases just this year that it was one answer. So there's people, and I'm sure you might be one of them, who just kind of has a feeling, well, I think it's this. I really think it's this. And come to find out, there's always a lot more to it. Sometimes you're right. It's very rare. A lot of people are like, what? I really thought it was that, and we'll go over some of the things that come back. But here is a good slide. I would suggest even screenshotting, because this is really what comes back in a nutshell. And I break down what these things are. But nerve damage is rarely random. In most cases, there are many things going on. Like I said, 15 to 30 things that come back, maybe more, average. And that's for people 1 year in with nerve issues to 30 years in. The amount of years that you've been suffering doesn't necessarily correlate with what's wrong. It's just that it hasn't been found a lot of the time. It's just progressively getting worse. And now your nerves are dying, or you're having, further complications because of it. You're not listening to your body. And the problem is we don't speak nerve. I do. I feel like I do at this point. But your nerves don't communicate in English. They communicate with you by giving you symptoms such as diabetes. We'll say gout, GERD, rheumatoid arthritis, autoimmune issues, so many different things, guys. I'm not going to sit here and list all of them. But your body has been throwing off these, I call them check engine lights. By the time I have people come before me, there has been multiple issues throughout their life up until that point, and then their nerves will address or come into play, right? They'll be like, okay, you're not getting it. I gave you diabetes. And you're still not understanding why I gave you diabetes. A lot of people think, oh, I have diabetes. Okay. What we will find out is the why. Why do you have any issues? You can't spot treat the body. So I know you guys might be coming to me right now. You might be shocked even to hear, but I'm not just going to be testing for the nerve issues. You can't do it with this type of test. And that's a good thing, because if your nerves are giving off those warning signs, and you've already had those check engine lights go off, right? We need to see what the heck is going on. And there's always going to be multiple things. And I just want to let you know, I don't even believe in the diagnosis of neuropathy. So you can sit here and you can say, I have peripheral, I have chemo-induced, I have chemical-induced, I have this, or I have that type of neuropathy. Or you could say I wasn't diagnosed at all. It's all telling your nerves firing. You don't really have to have any diagnosis. It's an alert mechanism. Neuropathy is a symptom. It's a symptom, guys, to something else. Does this make sense? Please tell me. I'm not losing you guys. I know this is a lot. But neuropathy, no matter what you've been told, and this is what I really want you to walk away with, one of the many things, it is a symptom. Okay? So nutrient deficiencies, guaranteed you have some type of nutrient deficiencies that have not been checked for. They don't check for, we'll say, chromium deficiency. Funny thing about chromium, I have people come to me for diabetes. Maybe they don't even have nerve issues yet, right? Their nerves haven't gotten to that point yet. And they have a chromium deficiency that's so bad that when we correct it, their diabetes goes away. If you guys look up right now, even chromium alone, that is all about your blood sugar and the regulation of that and insulin and all that, okay? So if you correct that, sometimes that has happened. It's pretty interesting, right? That alone, nutrient deficiencies, one of my favorite things to come back on that hair follicle test, because we test all of them. Guys, there's 60 different nutrient deficiencies. You don't even know half of them. It's so exciting to get them back to. And I'm going to throw myself under the bus, and I can't believe I'm going to say this live, but I'm one of those people that give to everyone, give all my love, my kids, you guys, my man, everyone. But then did I eat today? Right. I'm kind of that person. So, I did my own. I was deficient in 7 different deficiencies just like 6 months ago. Are you kidding me? So you can eat and breathe and do whatever you think is perfect, right? Because, hey, even me, a functional medicine doctor, right? Natural medicine, I live it, I breathe it, I promise. I do the best I can. I'm human though. And look what happened, right? So we all have some type of nutrient deficiency, and there's not been one case I've taken on where there wasn't one. And there are some that will directly, if you are deficient, it will kill your nerves. Could that be part of your case? Maybe. How would you ever know? There's no other test that does all 60. That alone is crazy. Amazing. And one of my favorite things to help you correct, you will notice a difference within a matter of days of correcting those deficiencies, just so you know. Toxic burden is very broad. I kind of mentioned a couple. I can't sit here and list off all 600 biomarkers, which is a fancy word for cells, guys. I'll just say cells. But the toxic burden would be parasites, mold issues. Those are the 2 most popular to find out. But there's a lot that can kind of go under that umbrella. Okay. And yes, we'll see. We don't just get back, oh, you have mold. We'll find out exactly what type, how long it's been there. Is it still circulating? That's huge. There's been a lot of cases that I've found where there's 100%. It's like very active. It's still circulating. So that would prompt me to tell you, I think you should have your home tested and go get those petri dishes. And I, if that's your case, I'll of course advise you and recommend what to do. And there's been more times than I want to say where we found together that they had mold in their home, then they had to have their kids, tests and right? Yeah, Michelle, mold. That could definitely be one of the things that are going on, because guess what mold does? It embeds itself into your tissues after about a year or so, maybe 2 years of circulating. After that, it settles and it'll embed itself into your tissues. And where are your nerves located? In your tissues, in that general area, right? Absolutely. That's definitely a thing that we will find. Metabolic dysfunction, inflammation, infections, nervous system imbalance. But if you don't test for these things, you're not going to see them. You will not. And that's why you're here, because you don't know, right? So the aha moment, I didn't need to try more treatments. I needed to identify the correct sequence, so these are my phases in a nutshell. Correct what's depleting the nerves, remove what's stressing them, restore what's missing. Now, what the heck that looks like for you, I have no idea, right? But let me tell you, I will break it down. I'm gonna have to put the chat to the side because I'm getting distracted. I'm so sorry, and I don't want to keep you guys for too much longer than we need to, right? I mean, this needs to happen also in the right order. So every case is different. I write more than one protocol. I don't do just one protocol for all 3 to 6 months because I am not the healer here. I am the vessel. I don't know how your body is going to take to whatever. And so we got to adjust along the way, right? We got to tweak things and make it to where your body is actually going to heal. That is honestly what changes everything. That one-on-one help, that individualized care. That's when I made this my life's work, to specialize fully in neuropathy, to help people who were dismissed, to give clarity where there was confusion, to replace fear with structured strategy. I'm going to take a break real quick, guys. If you have any questions, put them in the chat and we do go through. So everything changed when I focused on one thing, and that's precision. Not more supplements. I am definitely one of those people that I don't sell supplements. I do have it where you guys can get, you can save anywhere between 20 to 80%, depending, of course, off of supplements. So I do give you my practitioner discount. It's a wholesale cost. That's what it's actually called, wholesale. You can have that forever. I don't get anything from that, but what I do get is knowing that you guys are actually purchasing from a trusted source. You guys can find whatever. And I do recommend the least amount of supplements because less is more here, people. If I'm expecting people to be eating these supplements like candy, am I any better than an MD? Right? I know, yes, I want to help you guys heal, but at the same time, who's going to do that? That's just not even doable. And when it comes to supplements, I work with ages 2 years old all the way to, I think my oldest patient was 96. On those opposite ends of the spectrum, they can't really take pills. I'm just going to go ahead and say that, right? And sometimes anywhere in between. And so if that's you and you have a hard time, we have an option for you, I promise. There's liquid form, there's tiny bitty pill form, there's there's powder form, whatever, right? But less is more. That's my goal here. I don't want you guys to have to be spending a bunch of money, right? Not more medications, obviously, either. I don't even touch the medications. Not more opinions. Let's get those out of here. We need the testing, the interpretation, the sequencing. That's the difference. Hope you guys have learned a lot already. It's different, right? It's different than what you've been told. So this is why I built the root cause neuropathy framework. I needed it to be different. Obviously, what was working out or what was being thrown out there wasn't working. That's what I need to say. So I have advanced testing beyond standard labs, obviously, and we're going to go more into that cellular test. Clinical pattern recognition, which comes with expertise, I have to say. Personalized correction strategy, structured 3-month repair plan. 3 to 6 months. I'm going to give it a little buffer there, right? And I think I put 3 to 6 later. Today, you'll see exactly how that works. So here's 3 core problems most people with neuropathy face. And I want to see if you guys can tell me which one you're mainly dealing with right now. Problem number 1, uncertainty. You don't know what's causing it. Problem number 2, dismissal. You're told it's normal, right? Aging. Oh, I hate that one. Or untreatable. Problem number 3, fear of progression. You worry about permanent damage or loss of mobility. Put your questions in the chat, please, guys, in the Q&A section, please. Thank you. I want to say one of the worst cases I ever worked with, you guys are going to be blown away when I say this, because most of you in here are probably over the age of 40. That's the average. I would say anywhere between 65 to 80, 60 to 80 is usually most of you guys. Yeah, all 3, 1 and 3, all 3. I'm so sorry. Gosh, yeah. So one of the worst cases I worked on, 9-year-old boy had every deficiency that you could have. Do you think his body was out of whack? Do you think that what's crazy is his parents were like, that's so interesting because we don't know him any differently and he doesn't know how to feel any differently than what he's already known up until now. He has these issues, but when we reincorporated, and that was a hard case. That to me was a hard case because of his age. You can only help a child for so long, right? And then they're like, I'm done. So, but man, I'm against multivitamins, I have to say, but with this child, multivitamin it is. And we did smoothies and, incorporating, and even for you, that might even be something smoothies, right? But those just alone, I'm not even going into the mold that this person had. I'm not even going into some of the other issues. There were so many things, but one of the biggest concerns, and I actually did prompt the parents, and I haven't had another one of these this bad, to get an autoimmune disease test. And also I did have them do a cancer screening, which thankfully that came back all good. Yay. But when we corrected those deficiencies, this child went from what they thought was normal, what he felt was normal, to excelling in life and just being happy. But if we didn't find those deficiencies, especially iodine alone, his body would have been an environment for cancer. And so we need to find what's going on with you, right? If you have the alerts going off, which they are, there's something going on, right? So it's not just age. Let me wrap it back up. It's not just age. I know a lot of you have been told, well, you're getting older. Dismissal, that's what that is. Good job, Judy. Yes. Problem number 1, uncertainty. What it really feels like, and I'm sure you can relate. You're told your labs are normal. You don't understand why symptoms are worsening. You Google constantly looking for answers. I've been there. Every new symptom feels alarming. You don't know what to prioritize for first, and it's exhausting. Problem 2, dismissal, the hidden emotional toll. You feel rushed through appointments. I hate that one. We would wait months to get in, and then I would be there for 10 minutes. Are you kidding? Do you care at all? You're told to wait and see. Wait and see for what? For it to get worse? And then no. You're offered medication instead of explanation. Or how about empathy? That's one thing I feel like with conventional medicine, some doctors, thankfully, still have that empathy, but it's all so money driven. Right? At least that's my opinion. If you don't believe that's fine. But from I have a lot of respect for MDs. Please don't get that wrong. Please. Like I said, if I need medical emergency help, I'm very thankful for them, right? You start questioning yourself. You feel like you're navigating this alone. That creates hopelessness. When I was going through what I was going through, I questioned myself so much that I thought that I was maybe even at one point making up all the things because they would make me feel like it was anxiety, which caused anxiety, right? It was just dismissal. And so I definitely can relate with this one. Problem number 3, fear of progression. This is the quiet anxiety. And this is what keeps you up at night if it's not the zapping and tingling and numbness, right? What if this gets worse? What if I lose more sensation? What if it becomes irreversible? Am I missing my window to act? What will this look like in 5 years? And that fear, it doesn't fully go away, right? Unless you're not having the issues anymore. So these problems create what I call the neuropathy limbo cycle. It's just like a vicious cycle. Symptoms, confusion, medication, no clarity, and then you have anxiety, and then you get more symptoms, and it just repeats over and over, right? I love the amount of positivity. Judy says, I'm 84 and still not willing to give up. Bless your heart. Mary, I'm 76 and still not giving up on improving. I'm really proud of you guys because I know for a fact that you have been burned by many people that have overpromised and underdelivered. You don't trust me, I'm sure, and that's okay. I wouldn't either. And yeah, I feel for you guys, and I'm really proud of you for continuing to look, continuing to try, right? Because you have to be an advocate for your body. And that's what I try to do also with every person I work with, is be an advocate for their health also, finally, because you guys deserve it. You do. So the good news is there is a way out. When you identify the drivers properly, you replace panic with precision, and precision is what changes the outcomes. Let's destroy some dangerous myths about neuropathy. One of them I already did take care of, but these myths keep people stuck in symptom management instead of root cause correction. And they may be questions even that you already have. Myth number 1, if labs are normal, nothing is wrong. I hope you already know this and why, but standard labs do not measure many of the drivers of nerve dysfunction. Normal does not mean optimal. And it certainly does not mean your nervous system is healthy. If you're feeling what you're feeling, there's a reason. Myth number 2, neuropathy is always permanent. While there are cases I've taken on where there was structural damage, say like to the spine or any of the cervical areas or whatever, right? What we will do is still find out what the underlying issues are that are preventing for healing, because the body is meant to heal. So obviously it would make sense that symptoms of any sort, right, can improve when you focus and find those stressors, and you can remove them. If there's deficiencies, you can fix those. They're really going to help. Okay. You're still going to have some type of movement forward in a new chapter of health in some way. Myth number 3, medication is the only option. And I hope you've already kind of seen the difference of that, right? Remember the root canal. Medications suppress nerve signaling, and we need that. We need the nerve signaling. They do not identify why the nerve is distressed. It manages the sensation, but it doesn't correct the dysfunction. And that's also why you guys are buying all these marketing schemes out there for pills and creams. And I know you have, or you've been marketed to do so, and they just aren't going to work. Some of them might provide some type of temporary relief, but it's not going to correct the real reasons why your nerves are reacting in that way in the first place. And that's what I do. Okay. So introducing the root cause neuropathy strategy, we kind of went into this, and we're going to break this down more for understanding. But step 1 is that comprehensive hair follicle lab analysis of over 600 biomarkers, which is, remember, cells, and the food and candida panel, which is definitely needed. Just take all the guessing out of everything, right? Step 2, that's where I will identify exactly what it means for you, what is going on, break it down so in like actual English so you understand it and not just all this medical terminology. And step number 3 is a structured treatment plan targeting what we find. Obviously, if you have the blueprint as to what really is going on that's never been found, there has to be some type of improvement that comes with that, right? It's very simple in structure, but it's very precise in how we take care of it. So let's dive deeper into each step, because I know this is what you've been dying to hear. So step 1, and by the way, I need to remove this picture because my marketing team failed. We do not cut your hair. It's a hair follicle. We pull it from the actual root. We need that follicle. We need all the information. The longer the hair, the better, by the way, people, because hair holds memory. So most people skip this main step because they don't have it. They don't know about it. They're just testing all the other tests. They don't know, or they rely only on standard blood work, which is great for what it's great for, but you're going to be able to find out how your organs are doing, how they're functioning, what your lipid panel looks like. But why? Say like if you get something back that's not right, why? That's what this test will tell us. Why there's things that are coming back or not even, right? We're going to see that. And I don't know if you were here in the beginning, but if you were, I do have a guarantee, a root cause guarantee that I will get to. We're almost there, I promise. And then we're going to go to the beautiful Q&A and provide some more information for you, whatever that looks like. If you cannot correct what you haven't identified, then you're not going to have any healing. This testing is what's going to determine what to do. Step 1 in action of the Advanced Hair Follicle Lab Analysis and Food Inflammatory Panel / Candida screening. Over 600 biomarkers will be analyzed. Actually, I need, that's just for the hair follicle, the food inflammatory panel, it's over 250, which includes that candida, okay? So we're looking at everything, all right? Nutrient deficiencies will be identified, guaranteed. You have some. Toxic burden patterns will be revealed. Inflammatory markers are going to be assessed. Metabolic stressors will be evaluated. And your nervous system imbalances will finally be uncovered. This is going to give clarity, not guesses. And you have to think about what that is going to feel like. Just understanding alone, what the heck is going on with me? Why are my feet doing this? Why are my hands doing this? Why do I have these feelings, right? Step 2, root cause identification. Testing alone is not enough. The key is having an expert who knows what it all means, who recognizes the patterns and what to do about it. I'm going to provide also the understanding of how the deficiencies. I'm not just going to say, okay, you're deficient in selenium, vanadium, chromium, or whatever, whatever it is, right? I'm going to say how that's directly related, if it is, because not every deficiency would be, to your nerve issues or other issues you put on the intake form. Say like you've been battling gout, say like you've been having tinnitus, or I don't know, right? Vertigo. I've gotten that. I've gotten it all, it feels like. We're going to address all of the issues, and I'm going to break it down so it really makes sense. You know, that's huge. Finally understanding, and a lot of, I want to say 99.9% of the time when we have that consultation, I can see the weight being lifted, although it can be overwhelming because you go from nothing coming back to a lot of things coming back. So it can be overwhelming, and you have to have that breakdown. Toxins, inflammation, metabolic dysfunction, and how they all interact. This is where most practitioners fall short, and I truly believe it's because they don't understand, honestly, when it comes to the nerves. It may not even be a lack of education. It might be a lack of having the education is a big part of it, guys, but it might be also a lack of not having the type of test, right? Step 2 in action, clinical pattern recognition. This is what that looks like. Identifying what is depleting your nerves. I'm going to do that when we have basically step 2 in a nutshell. This is our lab results consultation, right? I'm going to identify what is depleting your nerves, identify what is inflaming or irritating them, identify what is blocking repair, and determine what must be addressed first, because things have to be in the right order. You can't just do that detox, right? I don't believe in the detox. It doesn't work, especially with nerve patients. And create a correction sequence for you. This is strategy, not trial and error. Actually, the protocol per phase, the first protocol is actually what takes the longest for me. That takes like 1 to 2 weeks sometimes, because I'll go through every one of your supplements you're currently taking. A lot of them, there's a lot of times I have to have you pause them all because they're actually working against you, we found out, or there's things in it your body absolutely hates and it's reactive to. And you didn't know. You thought you were taking ginkgo biloba to help your mind and or whatever. I don't know why I brought that up. Maybe I need it. Step 3, structured treatment sequencing. So what that is, once those drivers are identified, we're going to correct in order, not all at once. Remember, not randomly either, but in the right order. And this protects your system and supports real repair. Step 3 in action, personalize 3 to 6 month. There's that 3 to 6 month plan. Correct the deficiencies, reduce the toxic burden, stabilize metabolic function, calm inflammatory patterns, support nervous system balance, and monitor and adjust based on your response, right? Because like I said, I might look at your intake forms, all your labs, and come up with a beautiful protocol that I think would be great for you. And I have prayer embedded. I pray over your case, which I feel like is a big part of the healing process. But let me tell you, we're going to have to adjust. We're going to have to adjust as we go, right? I am not perfect. And I don't know how your body is going to, we're going to probably have to adjust. So I have a policy where I expect over communication for once. I want you to over communicate, and I do the same. And that's how we get to where we need to go, right? So precision, not chaos. When you complete all 3 steps, here's what happens. And I hope it's connecting for you, right? Obviously, you're going to understand why your symptoms developed. You're going to stop guessing. You'll reduce drivers stressing the nerves. You're going to support actual repair. And you're going to gain measurable improvements. You're going to feel in control of your body again. That's huge. Client breakthrough. I was pre-diabetic with chronic neuropathy, pain in my feet. My doctor only offered gabapentin. Dr. Guthrie's approach helped me reverse my blood sugar levels, reduce inflammation, and I can walk without pain again. I'm beyond grateful. That was a really great case because he was actually in a wheelchair. And like he could stand up for short bouts. It was such a beautiful outcome. Anyway, here's what clients tell me after starting. I finally understand what's happening. Notice I'm not saying I'm 100% healed. Everything's great. I'm the best health ever. I mean, you're definitely going to be a lot of things corrected, right? But yeah, I feel calmer knowing there's a plan. My symptoms are improving. I'm sleeping better. I don't feel helpless anymore. Clarity changes everything. It really does. And that's the problem, right? You haven't found the right test to find out what the heck's going on and then know what to do. The blueprint. You need the blueprint. So the results speak clearly. And I really want you guys to pay attention to this because a lot of people ask and then they'll put it in the chat 4 times. Many clients report up to 70% improvement within the first 21 days. I'm going to go and say probably 30 days of starting the correct plan. Sometimes it's even the first week or 2 when you get those. If there's crazy deficiencies and we correct those, sometimes that might even be what needed to happen, as well as the other drivers that we find, right? Others see steady reduction in burning, tingling, and numbness within 3 months, not because of luck, because we address the root cause. And I want you guys to be reassured that at the end of this, obviously I'm going to talk about working together, but I'm not selling anything, right? I know you're expecting me to be like, okay, so here, buy this pill stack. I'm not going to do it. But here's what I find most powerful. It's not just a symptom improvement. It's the shift from fear to clarity, from panic to plan. From what's happening to me to I know exactly what we're addressing. And that shift alone is life-changing. I like to say you can't unknow or unsee what you find out. So you can only move forward in your health from there. There's only a good outcome to come of some sort, right? If you finally find out all the drivers. What if I've had this for years? Some of you guys are thinking of these things, right? What if I've had this for years? What if I've already tried everything? What if my case is too complicated? And we're going to address those. I've had neuropathy for years. The duration, I've kind of already said this, but maybe you didn't hear, but the duration does not automatically mean irreversibility. It means drivers have likely gone unaddressed. The longer something is present, the more strategic the way we go about it really matters. And that's really where I come in. I've already tried everything. I get how you feel that way, but you haven't tried this. I can guarantee it. Root cause healing would make it where that you didn't need to be here today. Most people haven't tried everything. They've tried random supplements, and maybe that's what you think is root cause healing. You don't know what you need, though, or don't need. Symptom medications, isolated protocols. They haven't tried a fully integrated root cause strategy built specifically for neuropathy. I'm not sure this will work for me. I completely get this hesitation because you guys have wasted a lot of money working with people that overpromise, underdelivered, or promise the world. And I'm not sitting here promising the world, right? Disappointment from incomplete strategies does not mean your body is beyond help. It means you haven't been given the right things to do or how to find out exactly what's wrong and then what to do about it. You haven't worked with the right person. But if you're here, I mean, I believe it's aligned. The people who get the best results have one thing in common. Hopefully I'm not talking too low. I'm all getting quiet. They stop waiting. They stop hoping symptoms stabilize on their own, and they decide to investigate properly. I should probably open the chat if you guys are saying something. I'm so sorry. Yes, and keep the questions coming. Thank you, Kevin. By the way, Kevin, you're amazing. I think I said that. If you're still here, that tells me something about you. You care about your independence. You care about your mobility, and you don't want to look back wishing you had acted sooner. We're going to go into how to get the test. I know you're dying to know. I typically hear, I just want to know what's going on. I want to stop worrying every night. I want to protect my future. I want to feel like myself again. When I heard the other day that broke my heart, I want to be able to enjoy my grandkids. And I was like, there's been many cases I've cried with you guys. I'm very empathic. And I think that's why a lot of people like to work with me also. But yeah, I feel these things. I get it. Here's what I want you to understand. This is not about chasing perfection. It's about preventing progression. It's about correcting what can be corrected. It's about giving your nervous system a real chance finally. This is the most non-scammy scam, right? Most people think neuropathy just happens, but the truth is neuropathy usually develops when multiple stressors or check engine lights stack up over time. And when those stressors are identified and reduced, improvement obviously will become possible. Does it make sense? I'm not overselling here. It just makes sense, right? It makes sense. You just need to know what the heck's going on. So far, I'm very impressed with my experience. Dr. Guthrie has been incredibly helpful, understanding, and easy to communicate with. After thorough testing and reviewing my results, she provided a clear protocol to address my neuropathy. I've seen many doctors, but none as thorough as Dr. Guthrie. I highly recommend reaching out to her. The Root Cause Neuropathy Program. This is my structured, personalized implementation process for those who are ready to move beyond information and into action. It includes everything required to identify and address your specific drivers. Let's get to it, right? Here's what happens when you work with me. You receive advanced testing and interpretation. You receive a structured plan built specifically for your results. You receive guidance through sequencing and adjustments. You receive clarity, 100%. You receive a root cause guarantee. If I cannot get to the root causes, because there's more than one, I will give you back your money 100%. There has never been a case that I've taken on out of all the cases I've worked, nerve issues or even other issues, where we weren't able to find out why. So if you're the first person, okay, here, I'm going to give you your money back. And that'd be really sad because I'd feel defeated too for you and me. It would be the first. Every case that I have taken on, they're all hard cases. They're all hard. No one was able to help them, right? I guarantee that your case is not harder. I've worked with those. So let's get into it. Kevin, please put the links for if they want to work with me, how they can get these tests. Also, if they don't want to work with me, they can still get the testing done, right? And I will break down these for you, the cost. There's payment plan or payment ability. I'm losing my brain cells. I need to eat probably, guys. But anyway, option 1, the all-in root cause treatment plan. That's the best value. That's only if you purchase today. Okay. And I only take a certain amount of people, by the way. But option number 2 is the root cause discovery kit. So that is, both of these are going to come with that guarantee, by the way. And the root cause discovery kit is where I don't see it linked. Kevin, you might have to do HTTPS and then that semicolon. You know how you do that? Because it's not clickable for them. Make it a little bit easier. Both begin with advanced testing. The difference is readiness level. Both come with the root cause guarantee. So the all-in webinar special, that's to work with me for the full 3 to 6 months, everything included. So that includes all the labs, everything for the whole time. Okay. 4 consultations. So yes, $29.99 is typically $4,000. Okay. But today it's $29.99. We could break that down into a payment of $100 or more. I mean, it depends on what you're comfortable with. A lot of people want the least amount. And it also comes with that lifetime supplement discount. There we go. There's the clickable link, guys. Okay. So this is for being all in, working with me directly. If that's what you want to do, great. I would love to take your case on. But this also comes with the root cause guarantee. It comes with all the testing, 3 to 6 month personalized treatment plans, I like to say, because I write up multiple phases, right? And an 87-page root cause reset ebook. Now, he just posted our phone number, but I want to say that we're having a weird thing with Verizon. So any Verizon callers, it's giving a weird, it says like you've called Verizon. So I'm just letting you know, text will go through still, even if it's Verizon, but I have already called and alerted them and they are looking into it. Something's weird with the Verizon tower here or something. I'm in California, by the way. I don't know what's going on, but when I call, I have Verizon, it won't work. When my husband calls, he has AT&T, it's working. Something's weird. So anyway, if purchased separately, the lab analysis is $997. The treatment would be $29.99. So you're saving $1,000 today, right? Now, if you want to just get to the root cause, take that and figure it out from there. The labs alone are $997. It would be $60 per month to do this option, right? So you're still going to get all the answers that you need. You absolutely need to know what the heck is going on, right? So if you are weary about, me or whatever, okay, fine, but you're still going to want to also get your results. You definitely want to do that. Cindy, maybe Kevin, can you send the link, please? People are not seeing a clickable link. So the root cause discovery kit, that is with that hair follicle and the finger prick test. We're going to still have that lab results consultation. I'm not going to just send it over to you. Obviously, you will get all your labs, but I'm still going to break it down. This just doesn't include working with me, okay? You're still going to get all of your answers in that blueprint and do what you want with that. So at least you'll know what is really going on. It is still guaranteed. Yes, you will get your money back if I can't figure it out or if nothing comes back, if you're the first person. So it's guaranteed. You will find out. So either way, they're there. What you're really getting though from both of these, you're not just getting lab data. You're not just getting a supplement list. You're getting finally a structured strategy, the right way to go about it, clinical oversight from someone who actually cares, and the clarity. And that's what you need. You guys need this blueprint in order to figure it out. Here's the thing. I built this specifically for people who were told they had no options. This is not priced for mass volume. It's structured for serious individuals ready for real answers. Honestly, after purchase today, I will not be taking any new patients. I don't want to be overwhelmed. Okay. What would this be worth it to you? What would clarity be worth? What would reducing burning and tingling be worth? What would protecting your mobility be worth? Or sleeping without fear? So why this investment makes sense, you've likely already invested in a chiropractor, right? Medications, supplements, alternative therapies without clarity. This gives you structured direction, answers that you need because you can't heal what you don't know, right? Here's my commitment. If I am unable to find out the root causes as to why you are having nerve-related issues, as well as other issues, because there always are other issues with it, you will get your money back 100%. No delays, no excuses. You would be the first person. Here's the reality. We can only take a limited number of private clients at a time. And that's a good thing. You don't want to feel like I have a bunch of other people I'm working with. That's what I want. I want personalized care, not group programs. Those do not work. So once the spots are filled, enrollment will close. The link will not work. I am telling you right now. This is not for everyone. It is for those who are ready to stop guessing, who want data before decisions. That's big on me. I'm a researcher. I want to see what is going on, and then I'm going to believe it, right? Value structured correction and are willing to participate. If you do nothing, symptoms may stabilize or they may progress. Uncertainty is going to continue. Anxiety will continue, and that cycle is going to repeat. If you act, you replace certainty with clarity, you replace fear with strategy, and you move from waiting to protecting. 1 year from now, you'll be in one of two places, still wondering what's driving your symptoms, or clear on what caused them and have corrected the issues. You can only move forward from what we find out. You can only move forward, right? Yes, I'm going to actually share my screen in a second, and I will show you guys how to get to those payment options. I think that's the biggest question, but I'm also going to go through all the other questions. Okay. Picture yourself from now, 90 days. Picture yourself 90 days from now, understanding your lab results, because you will. Seeing measurable improvement, sleeping better, feeling steadier, knowing you acted when it mattered. So here's some FAQ, some questions that we find are asked a lot, right? What if my neuropathy, what if my neuropathy is severe? That's exactly why precision matters. We need to figure out what's going on, not guess anymore, and then have the right care plan based off of that. That's why this really needs to happen. How soon will I see results? Most people notice an improvement within a matter of days. Others are gradual. Others see gradual reduction over 3 months. This depends on what's going on, right? And it also depends on your medical history. I'm going to be gentle. I'm not, especially for my older folks or even those that have a more intensive case, we'll say, I'm not here to just push you out. We're going to get to where we need to go, slow and steady sometimes, right? Every case is different. Is this medication based? I hope you know the answer to this. No, this is a non-pharmaceutical root cause strategy. Cindy, that's a great question. Please put it in the Q&A, or Kevin, can you put that over there because I'll forget. Non-pharmaceutical root cause strategy focuses on restoring function, not masking symptoms. So your decision, you can continue navigating uncertainty or you can choose structure, clarity. If you're ready to investigate properly, select your option. Okay, so I'm going to go into the checkout. Give me 1 second though, guys. I'm going to take a mini break. I'll be back in 2 minutes, okay? Okay, I'm back. Thank you for the break, guys. I had to give my voice a little bit of a break, right? Let me take another drink. Okay, I'm going to share my screen. Okay, hopefully you guys can see my screen. So this is the link. This is going to kind of break down more what's included, but for consultations with the all-in, yes, I'll go into, what the average, what it looks like for cost, any supplements or anything like that. But this link is going to go to both of them. And I want to specify real quick. You don't want to click both. If we get that you spent this much, I'm going to reimburse you because I'm not going to be taking your money. They both come with the root cause discovery kit. This one just comes with also the care of whatever we find. And just so you know, that's actually a very, very good price for the all-in, because even one protocol that I write up, and you'll get at least 3, those are about $1,800. People will bring to me sometimes their labs and have me write up like my care plan of what I would do. And that would be the cost for that. So you're saving so much money. I mean, this is for 3 to 6 months. I don't know how long it'll take, right? But typically not over 6 months it will take. Anyway, so you pick which one is best for you. We'll do this together. You would go to Affirm is the one I recommend, but there's also Afterpay, Klarna. We'll kind of look at those. Affirm is the one that I love. I use it for kind of a lot of things. I loved it so much that I brought it to my my practice. It took a long time to get these approved for healthcare of some sort, functional medicine, right? They're usually retail. And what I like about them is they don't pull your credit, right? A lot of people, I don't know what's going on, but I want to be able to help as many people as I can in my lifetime. And I think money is the biggest issue. I could charge a lot more because I'm award winning. There are a lot of other doctors that would charge like $15,000. And I think that's ridiculous. This is all that I actually need to be able to do what I need to do. I'm not overpricing. It makes sense, right? So you pick whichever. If some people have even money with these, like they have credit. So here, if you wanted Afterpay, you could go there. If you wanted Klarna, I still recommend Affirm. Obviously, I don't get anything from it like a referral or anything, but look at their options. So for the all-in, of course, and we can change that to the other one to see, but it would come out to, if you wanted the interest added, but less amount per month, the 103. Now, if you don't want any interest, right? Who wants interest? And you can do the 250, well, there you go. Because if I was to do through my practice, the least amount that I take up front is $999.67, 3 months of it. And the reason why is someone has to pay for the labs. When I buy the labs, it's literally $997. So I'm not making any profit off of that. Okay. That's literally to pay for the labs. I'm hoping when I break everything down, then you're like, if you go to just the other option, here we can put that in. Oh, $7. So that'd be great, right? If you go the $997 option, which is totally fine, I'm hoping when we meet on the root or the consultation that finally you have some faith in me that I actually said what I was going to do, right? And so if that's what it takes, okay, cool. But $62, right, to get the answers. $83, interest free. $166 if you want to just do it in 6 months. So $62 per month. Yeah, you would be a little paying by over 122 more over 18 months, but it breaks it down so it makes sense and you're still going to get the answers. What you do with that, I mean, if you don't want to work with me, obviously try and find someone you trust and that will understand how to read the information, But yes, so that's what this looks like. I hope that helped answer those questions. Both links will go directly to. So see, you can go just this one, right? And you have the same options. Obviously, You do bank or you could do card, whichever works. Okay, back to you guys. Let's see. I'm going to go to the Q&A. Oh, you guys are you guys not hearing me at all? I'm seeing no connection now, not getting anything. I can't read these forms on mobile phone. Oh no. Okay, Lisette, can you put in the private chat, or Kevin, can you write Lisette and get her email? And then I can send these to her, or you can. Here, Q&A. I've already seen a neurologist and they told me everything looked normal. Can you still help someone like me? Well, this is actually one of the most common stories I hear, honestly. Many of my clients have had multiple MRIs, nerve conduction studies, the standard blood work, yet they're still dealing with burning, numbness, tingling, or pain. So normal testing doesn't always mean nothing is wrong, as what I've explained this whole time. It often means the root cause hasn't been identified yet. So yes, once we figure out what's going on that hasn't been found, I hope that makes sense, that we would obviously be able to help. I can't see the chat, but I'm going to go back real quick. Got none of the details of the payments. I need to understand that. Okay, Gian, I'll go back through, no problem. But first I'm going to go through the Q&A and then we will go back over those. Okay, absolutely. I've had neuropathy for 10 years. Is it too late? Not necessarily. The longer it's been present, the longer healing may take, but your body still has the ability to repair. We just need to figure out what's going on. What if my doctor says my neuropathy is just from aging? Well, maybe you didn't hear that part, but it's definitely not just from aging, right? Growing older shouldn't automatically mean feeling in your feet, or like losing feeling in your feet, I guess, or living with burning pain, right? So we want to understand why those nerves are struggling. I've spent thousands of dollars trying supplements. How is this different? I love that question because most of you guys are there. The problem is most people are guessing. A lot of the time they're going, and maybe this was you went to another type of doctor, maybe even another functional medicine doctor, and they had you pay for all these different tests. So then they're kind of just trying to figure it out. And then they're trying to figure out, well, maybe try these supplements because they didn't know all the deficiencies you had, guaranteed. It's all guessing. Maybe try this diet. Maybe try this, So we test first here. We're going to identify what your body is actually dealing with. Then build a plan specifically for you. Can heavy metals cause nerve problems? Absolutely. Certain heavy metals can definitely interfere with your nerve signaling, with the mitochondria and nutrient function. Can candida really affect nerves? Yeah, I did talk about the candida overgrowth. I see typically seven out of 10 people have a severe candida overgrowth that I work with. And yes, absolutely. Candida is causing a lot of inflammation. In some people, gut imbalances and microbial overgrowth can contribute to inflammation, obviously, right? Nutrient depletion, and symptoms that overlap with nerve dysfunction. It's one of the pieces of the puzzle. It's not going to be the end all be all though, right? Do I have to stop eating everything I love? No, I think I even referenced, I have found that it doesn't make sense to completely eliminate everything. I don't believe in unnecessary restriction. I don't believe in having you guys eat lettuce only for 3 to 6 months in order to actually heal, right? Okay. How long does it usually take take before people notice changes? So a matter of days, sometimes a matter of weeks. Typically, on average, I say within the first 30 days, you definitely will notice a difference. There has been full neuropathy reversal, I can say, within, I would say 60 days, although not as common as a little bit later. And also, I'm not here to say that I'm going to fully reverse that. There have been a lot of cases that I've worked with where it has happened. What if I've already tried functional medicine? Well, the thing is, kind of like what I said, functional medicine is not a one size fits all. Different practitioners use different testing, and they also specialize in different areas. They use different protocols, different philosophies. So previous experience doesn't necessarily predict what another approach will find, right? Well, I have to take supplements forever. The goal isn't to keep you on a bunch of supplements. Remember, less is more in my case. I'm trying to think how else I can say. Definitely, I love my supplements. So this is a hard question for me because there's certain supplements I forever want to take them, such as magnesium glycinate. It's one of my absolute favorites of all time. It's so good for the heart, for the nerves, everything. There's certain recommendations I'll make. You're going to want to take this forever, something like that. But I'm not trying to have you guys now not having to take pain medication, but now you have to stay stuck on supplements. I hope that answered that a little bit better. What makes your program different? That's a good one. Well, I don't guess. I test. I find out all the information. It's guaranteed that we will find what others did not. And then that's very rare to get a guarantee, by the way. I'm going to explain all your results in plain English so you actually understand it. That sometimes there was one person I worked with, they said that they were trying to ask questions about their labs, and their functional medicine doctor got mad. That isn't going to happen with me. I want you to fully understand. But with that information also, I'm going to create a personalized step-by-step plan instead of handing you generic protocol that everyone else has tried and didn't work, right? So that's why I guess that's the best way I can answer that. What if I'm scared this won't work either? These are such good questions. I completely understand your fear. Many people come to me really after trying multiple approaches, wasting a lot of money, even seeing beautiful, holistic approaches such as chiropractors, red light therapy, things like that. But if you don't understand the underlying issues at a cellular level, which is where everything starts, right? The root causes, then none of those approaches are actually going to work. And so that's why this is different. That's why this will work in some way for you. Okay. It has to make sense. I don't know how else to say it, but the problem is that we just haven't gotten to your root causes yet, right? Is this just another detox? No, I've already kind of answered that. Why don't you just recommend supplements without testing? Because I'm not going to guess. Let's see. I have arthritis in my hips. Can that be a source of neuropathy in my feet? The arthritis is typically caused by a number of factors. Inflammation is one of them, and there's underlying issues that cause the arthritis, right? And so neuropathy is a symptom, arthritis is a symptom. We're going to find out what that looks like. It's all connected is the best way I can say it. Why do the bottom of my feet feel like I have socks on, a fuzzy feeling? Terry, I have actually heard this example in so many ways. Feel like you have socks on. I've heard of people saying even like they're walking on cotton, weird things, or even the arch. I've heard people say that it's like there's a ball stuffed there. We have to find out your why is the best way to put that. Does red light, infrared, and Something else help, also vibration plate. Those things can help eventually, but you still need to find out the root causes. I'm going to go back to the main chat real quick, see if you guys. Okay, connection problems. Hopefully not. It seems a little bit delayed. Oh. Okay. So real quick, I'm gonna pause. I'm gonna go back to the checkout because I saw some personal messages. People are desperately like, I don't get it. Okay, let me go back real quick. Share. Okay, here's that link. Okay, guys. You'll go to either one. They both lead to the same way. You'll put in your name, your email, your phone number. If you want payment options, you're going to pick between Affirm, Afterpay, or Klarna. I'll show you what that looks like. We'll go learn more. You'll pick which one. I can't go further than here because then you're going to see my personal information, right? It'll auto-populate. I have it where my thing just remembers me. But what it'll look like is you'll say, see if you qualify. It doesn't do a hard credit check, but it does what is called a soft pull. It won't ding your credit, but it's going to make sure that you would be eligible. 98% of people are actually approved because I have opened them up to my practice. So they trust my practice. There's no, people don't do chargebacks or anything like that. They're happy with working with me. I think if things like that happen, they would probably make it harder for you guys to get funding for this. But I have a good reputation, right? So this, I hope that explains better. You don't have to do payments, but most people don't have this money laying around, right? Now, let me show you again. If you wanted to start with just the labs, because you don't know about me, right? You don't trust anyone. I get it. Okay, fine. I want you to get your answers anyway. Whatever you want to do, I'll prove it. I promise you're going to get answers, right? And then you could start healing from there. So no interest. You pick 6 month, 12-month payment, 18 though. The longer you break it out, the longer you break it up for, that's going to be a little bit less, right? So most people, including myself, if I was ever to break down something, I'm guilty of this. I want the least amount, so I typically would go with this one. But to each their own. Choose the best plan for you. Payments may be reported to credit bureau. Yeah, if you make them on time, obviously, just like anything else. Pay monthly with debit or bank account. You can pay it off. There, say like if you want to just do this for a month or two and then, okay, you know what, I'm going to pay the rest. You can do that too. I'm going to go back to this one real quick. Remember, don't do both. And also remember that after the webinar today, I do not plan to take any more new patients this week or the next week, or I don't even know if I'm going to do another webinar for a couple weeks. I don't want to be overwhelmed, right? And if the link isn't working, I have turned that off. I'm good. I don't want to be, having a problem where you guys feel that I'm over capacity in any way. My goal here is to continue having good reviews, happy clients. And what I have to give you guys that individualized attention. So I just want to make that clear. If you're interested at all, you're going to want to do it right now. It's not to be pressure, but because this is something, it does get full pretty fast. And I'm, just saying. So this one right here, 103 is probably the one I personally would go with because I like the least amount. Now there is interest for that one. And then this one and this one, 6 month, 12 month. But remember, it's still least expensive than if you wanted to pay individually through my practice, which that is there. No credit check, but I break down $999.67, which is this total. And I won't do the I can't do the payments broken down for the labs because someone has to pay for those. So that's why I do the $9.99, right? It's just 3 months. So I kind of break it up that way. Hopefully that helped. Okay, I'm back. Okay, hopefully you guys can hear me. I'm going to go back through. For those who are still here, we still have a lot of people here. I'm not trying to be here for hours, though. I want to answer your questions. It's already been a while, right? This has gone over, but I'm trying to get to everyone. I was told I have idiopathic neuropathy for several years, and then the last neurologist said she thought it was erythromyalgia, a rare disorder the medical world knows very little about. Her parting words were, "Try to keep your feet cool." I'm sorry, I thought that was a question, so I read it out loud. And I'm so sorry they said that, by the way. Do you have any thoughts on red light therapy? I've kind of already said that. Red light therapy is great, guys. One thing you should know is less is more. If you do too much red light therapy, it actually will cause inflammation. So what we'll do is if you have, like, I love the face red light. I haven't done it in a while, but, I will customize that for you. I'll tell you with that megahertz, I would do, I would say, 20 minutes, 30 minutes, no more than this, no more than that per week, right? So you'll have a game plan. I've recently heard about AMLA. Has it helped anyone? My feet feel like they are on fire much of the time, even worse in the evenings till about 2 a.m. Well, we're going to find out exactly what's going on, Judy. Okay. So regardless if AMLA has worked for anyone or not, what will work is understanding what your body's trying to tell you by giving you those firings and nerve issues, right? Where are you located? Sacramento, California, but I do everything via telehealth. I've tried using a TENS unit for a short period, but it didn't make much difference. It's possible I didn't use it long enough. Joseph, the reason why is because we need to get to the underlying issues first. These are great. These type of things are good when you have all the underlying issues have been addressed. So you might need to help with even what is it? Oh my gosh, I'm drawing a blank. It'll come to me. But anyway, that's the best way I can answer that. We just need to, that's good to incorporate probably in phase 3. I got a lot of questions on TENS therapy. That's funny. Okay. Wow. 3 people. Are these tests covered by most insurance companies or is it out of pocket? It is out of pocket because insurance doesn't cover healing, unfortunately. But I am a national provider, so I have an MPI number. What that means for you in a nutshell would be we can super bill your insurance. Just let me know. That is an option. Also, we take what is it? The healthcare savings plan will be covered. It doesn't get kicked back. So HSA and FSA, I think it is, will cover this 100%. They do cover it. Is there more than one candida diet? Absolutely. I truly believe that just focusing on one diet doesn't work. We need to see what all is going on, right? And I also believe that like having, I don't know, for an example, just focusing on fish and only eating fish is going to give you deficiencies in other areas, right? So pick and choose. I noticed my cholesterol is going up and my neuropathy is getting worse. Can they be related? 100%, Charlie. Listen to your check engine lights. Yes. Did you say mold issues? Yes, Michelle. What about small fiber neuropathy? It does not matter what type of neuropathy, Mattia. It's those are symptoms. You've been given a title by conventional medicine for them to prescribe medication to you. I just started taking naltrexone 4.5 milligram with vitamin B12 1 before bed is the protocol. Have you heard of this for neuropathy? No, and actually that's very interesting to take B12, which is a stimulant. It'll actually give you energy right before bed. How have you been sleeping, Orlando? Yeah. It is Those two things can be good, but there's underlying issues. So don't mask it, right? There's other things. That's not going to be the fix all. What if that 20% buffer is the actual cause of your issue? Adrenal fatigue. Oh, are you talking about the 80-20, Gudrun? That 20% buffer I give you? Guarantee that's not the actual issue. I'll help you with that. What about stem cells? That's what I wanted to say. Stem cells are amazing, or exosomes are great for phase 3. So phase 3 is where it's different for everyone. But if we still haven't had the full, where you want to be, right? Full healing. For phase 3 would typically include, obviously, I don't have any access to stem cells, but if you're interested in those, I would probably suggest that would be the time to do them. Don't waste your money until then, until you have, because we'll take care of all the underlying issues by then. So you'll definitely have some, you'll notice a big difference in how you're feeling and how your nerves are acting and everything, but we might need to help with the healing process a little bit more. Regenerating the nerves is where that would help. Okay. So these things, like chiropractors are good for phase 3. Red light therapy would be good for phase 3 once the underlying issues have been addressed and taken care of. Is high cholesterol and feet burning, tingling related? Trevor, yes. All of it's all related. Unless you were to hit your foot on a door right now, which hopefully that doesn't happen, then no, that would be a different issue. But everything else, it's all connected. When do you retest? We typically don't need to, but if you want to, we can around month 3 or 4 is typically where we would do that. But you'll know that everything's been taken care of by how you're feeling and how your nerve activity is. If it's gone completely, okay, great. So every case is different, right? My liver enzymes are slightly elevated. Could that contribute to neuropathy? Absolutely, because your body's not able to remove toxins. So then they're staying there more, right, in your body. And then your nerves are like, okay, get this out. It's definitely one of the reasons. And we need to find out why, right? Someone said, where's chat box? But Orlando, I think you figured it out because you wrote in the chat box. How about toxic silicone breast implants? I mean, it could be one of the reasons, right? Would the treatment for neuropathy for diabetic induced or chemo induced? I don't know if that's a full sentence. Would the treatment maybe be the same? No. And we will determine that by what comes back. I just had knee replacement surgery. My toe numbness increased, correlation. Yeah, you have more inflammation right now because you're healing. Yeah, and other reasons, I'm sure. And if you were put under, obviously, yeah. Do you take insurance? No, I wish. But I can do a super bill. I have had success in helping eliminate tinnitus, yes. I can send a replay. Kevin, I think, is off work. You can go ahead and leave. You can go ahead and leave, Kevin. I'll go ahead and take it from here. Okay, Cindy, let me write down your email. Cindy, ETOOMEY, ETOOMEY at UMW. How about this? Here's my email. Cindy, this would be easier for me, okay? There's my email, direct email to me. And I guess I'm breaking up really bad. I'm so sorry. Thank you, Kevin. I will go ahead and leave you guys here because I have gone through a lot of questions, but if I didn't get to all of them, only because we've been here for 2 hours, right? If I didn't get to all of them and you were looking forward to that, can you do me a favor? I really want to answer that question. I know there were a couple more, I think. But my throat is kind of starting to stop. So dr.guthrie@therootedlab.com. I did put in the chat. Go ahead and screenshot that real quick, guys. Also, you can text me at this number. Thank you, everyone. Yes, but please don't take it personally if I didn't get to your question. Please email me. I would love to address that question, or 2 or 3. You also can book a one-on-one consultation with me if you want. Here's the link for that. If you're like, I don't know, I don't know, and you want to just talk with me beforehand, but I might be at capacity at that point. I just want to let you know. Oh, John, I'm so excited. Okay, good. So you will, once you receive the onboarding email, click the link that comes there, and it's going to bring you to my practice, which is Rooted Functional Medicine. Practice Better is our EHR. Fill that out. And in the filling out of that, I actually embed the lab form in there. So it can be confusing. But yes, it'll be in that. So just make sure you submit, and that'll get to me, and I'll have your lab shipped within 48 hours. I forgot to even say that. Once you guys purchase, we ship your labs within 48 hours. Okay. So just make sure though that you guys fill out the onboarding right after purchase. You should get, and if you haven't and you're still here, please let me know, or email, text me. I mean, I'm very accessible. But yes, we will definitely get that over to you, but you should receive an onboarding text and email immediately. Okay. And then it'll have a link in there to get started. Oh, Mary, God bless you too. God bless you too. Thank you so much. I'm so thankful for everyone that showed up, and I hope you guys learned a lot, because that's really why I'm here. I just want people to understand that there is another way. And yeah, conventional medicine is not necessarily it for this, right? A lot of respect for them, but this just isn't necessarily the right place for you. There. Here, I can help you, definitely. So I hope we get to work together, Mary. I haven't looked to see if you had purchased or not, and if not, God bless you back. And thank you everyone for joining. Okay. Please message me if you didn't get your question answered. Here it is right here. My email, dr.guthrie@therootedlab.com for those listening. You can go directly to my website at Rooted Function.